Hello there, I'm Aron Martirez, and I'm going to be performing CVP. So, just stay still and check me out. So today, I'm going to be performing central venous pressure monitoring. So, what is central venous pressure? Central venous pressure is a direct measurement of blood pressure in the right atrium and vena cava. It is by threading a catheter into the lower third of the vena cava. So it's very mostly used in intensive care units for patients who are severely ill, especially patients with heart problems. So doctors and nurses needs to know to accurately measure this one in order to provide the correct intervention and medication or treatment or management for the patient itself. So it's our responsibility for us nursing students to learn on how to actually determine this central venous pressure monitoring. So what are the purpose of central venous pressure monitoring? First and foremost, it is to check the fluid balance in severely ill patients. Either they have fluid deficit or either they have fluid excess. Second, it is also to make sure to estimate circulating blood volume. Third, it is to also ensure or test the function of the right side of the heart, which is very important, systemic circulation. Fourth, it's also to check if there is any circulatory failures or any heart problems. And fifth, it's to prevent further complications as soon as possible. I am Aron Martirez, and I'm going to be performing central venous pressure monitoring. So the first thing that you need to do is to make sure or ensure that all of the materials are inside the tray. It is so that you're not going to return to the nursing station if you forget something. It also shows the patient how ready or how competent you are as his or her nurse. Sir, maayong aga. Ako gali si Aron Martirez, ang imong student nurse halin sa West Visayas State University. Ako subong ara sa third year. Ako subong ang imong student nurse halin sa alas 7 sa aga pagto sa alas 3 sa hapon. So sir, pwede ko mabalaan ang imong pangalan? Okay lang lang, sir. Okay, Sir James Van, maayong aga liwat. Ako gali subong mga-perform sa central venous pressure monitoring. So, ano ba lang yung central venous pressure monitoring, sir? Ang mo siya, sir, ang pagpuwas ng atong blood pressure kung mabalaan kung hypertensive ta or taas atong dugo o pang dugo atong dugo. So, sa pamaagi ini, nga hindi na po dali sa atong ano balangan, usual balangan ginakuha sa atong kamot. Dinabutang ni atong sa atong tinipusuon, damit sa isa ka catheter, para mas napadali at para sakto ang atong measurements ng atong dugo. Also, sir, ginalantaw man ni ang measurement sang atong na purpose nga ni is that para mabalaan na yun kung ang atong talipusuon, ang right ventricular function sa atong talipusuon is mapag-bruise pa o kung weak na gid. Kaya para mabalaan ta kung ang katubigan o ang systemic fluid sa atong kalawasan is enough or ang ano ang status niya, manubo bala or matakas. So, I just identify myself with the patient, explain to the patient what is going to be doing to him as an intervention, and also do the two-patient identifier by letting the patient repeat his name and by checking his ID tag or his name tag in his wrist. So next is that I'm going to perform hand hygiene. Performing hand hygiene in front of the patient according to CDC allows the patient to entrust you more than not performing it in front of the patient. So it's better for us medical professionals to perform hand hygiene in front of the patient so that the patient will see that we are doing our job well. And of course, the main purpose of doing hand hygiene is to prevent the transfer of microorganisms. Next, we need to make sure that the patient is in supine position in order to obtain correct measurement of blood pressure. Sir, i-arrange na nakasura para mas namin ating yung pagkuha sa ating dugo. Next, we need to make sure that we need to check the IV or the intravenous fluid. First, we need to check the doctor's order in order to determine if the doctor really ordered some things to be put into the IV. Second, we need to make sure that the flow rate is correct because high flow rate or low flow rate has detrimental effects to the body. And third, we need to make sure that there's no kinking or tubing in the IV because having that will cause a risk of having bubbling or tickling in the IV and could cause detrimental effects such as embolism to the patient. So we just need for some minutes to wait the results for central venous pressure, blood pressure monitoring. After waiting and after getting the result, we need to stop the flow, or we need to turn the stopcock so that the IV flow we're going to be returning in its original state. It is very important to actually put it or return the IV flow to its original state, so don't forget it. Next, we need to make sure that the IV flow or the drip factor or the flow rate is according to the doctor's order or physician's order. So, in order to prevent fluid overload or fluid deficit. Sir, tapos na sir sa aton nga pagkuha sa ating nga dugo o sa ating nga blood pressure. So sir, okay man yung kamatsagan subong. Wala man ta sa amin namatsagan sakit kung ang ano man da sa ating palawasan. Nami sir, good sir, kaya wala kami namatsagan subong. So sir, hambal ko na sir kung may kailangan ka, kung ano mang din, kay ano lang ka din sa nursing station para magatuan ka kung mabuligan ka. So, I asked the patient on what is his experience about the intervention itself. So it's also very important for us to make the patient into a comfortable and feel the patient he is safe around us, so that the patient will ensure to himself that he is comfortable and safe in the hospital environment. Next, we need to perform hand hygiene every after procedures. So it's very usual for us, the nurses and medical professionals, to perform this one in order to prevent transfer of microorganisms from one patient to every patient. And of course, we need to make sure that we're going to document materials, like for example, dressing changes, tubing changes, and the tolerance of the patient into the procedure. And of course, we need to make sure also to document on the result of the CVP and the date and time of the procedure. So that's all for central venous pressure. So, how do we interpret central venous pressure monitoring? So the first one is to know the normal level or the measurements of central venous pressure. The normal measurement or the normal range is between 5 to 10 centimeters H2O or 2 to 6 millimeters of mercury if taken in the mid-axillary line of fourth intercostal space. Also, there are several factors that affect central venous pressure monitoring, including medications, heart disease, response to medical treatment, and many more. Also, we need to make sure that always that central venous pressure is used as a conjunction to such tests like respiratory, pulse rate, and of course, your blood pressure. Next, we need to make sure to identify the normal range so that we'll be able to know if it's low CVP or high CVP. Low CVP, below 5 centimeters H2O or 2 millimeters of mercury, indicates hypovolemia, while high CVP, which is above 10 centimeters H2O or more than 6 millimeters of mercury, indicates cardiogenic shock or fluid overload. So, what are the pertinent precautions that we need to actually put in our mind when performing central venous pressure monitoring? First, do not rely just on the result of central venous pressure monitoring. Use it as conjunction to other assessment data, like your laboratory test and ECG. Report abnormal findings to the physician immediately. Second, test the patency of the central line by administering 10 ml saline. Also, make sure there's no kinking or blocking in all tubes. Third, you need to check for a series of blood pressure in 15, 30, 60 minutes and as ordered. Fourth, we need to practice strict asepsis. Fifth, we need to change the IV solution every 24 hours and then the IV tubing every 48 hours, or based on hospital policy. Also, expect that the doctor is going to change the catheter every 72 hours. Next, in pertaining to the just before statements, we need to label the solution, the tubing, and then the catheter in the order or the date in which it was being changed or being administered, so that we would know when is the next time that we're going to change it. So that's all the important things that you need to remember in administering or doing central venous pressure monitoring. So that's it. That's my video. Thank you for watching.